Hi, I'm Nicholas with Nightingale College, and this is my skills assessment video for the colostomy care. As you can see, I'm wearing my Nightingale scrubs. I have my Nightingale ID badge, and the supplies that I have here. I have my patient with their colostomy bag and base plate already installed. I have here some gloves. I've got 2 cleaning cloths, a trash bag. I have my stoma guide. I have my stoma solution, my stoma care. I have a pen and scissors. And what I'm going to be doing to start the process is I'm going to walk into the patient's room with all of my supplies. To begin, I'm going to knock and come into the room and close the curtain behind me for patient privacy, and then I will introduce myself to the patient. Hi, I'm Nicholas. I'm going to be taking care of your stoma and replacing your colostomy bag today. Can you please tell me your name and your birthday? All right, and then I visualize the patient's wristband to confirm the name and the birthday. All right, so as I mentioned, my name is Nicholas. I'm here to go ahead and take out that stoma bag and get that replaced there. Is that all right if I go ahead and begin the procedure? All right, I've got the patient's permission. So to start, I'm going to sanitize my hands. Then I'm going to take my gloves here and put my gloves on. And to begin, the first thing I'm going to do is go ahead and going to be taking off the patient's colostomy bag. And as I'm taking it off, I'm going to be observing the contents of the stool. I'm going to go ahead and begin that here. And being careful not to drip too much onto the patient's stoma, I went ahead and lifted it up here, face up so that it's not dripping. And I'm going to be evaluating the contents of the stool, looking for any blood or mucus. And I'm going to take the stool and dispose of it in the appropriate reciprocal, whether that be the toilet or another designated place. The physician may have ordered a stool sample or to measure the stool. So prior to disposing of it, I will go ahead and check the physician's orders to make sure that there were no orders placed. And then what I'll do is unroll this bag here, dispose of the contents into the toilet or the proper reciprocal. Prior to doing that, of course, would have set up my trash bag, which would have been in a red biohazard bag in the room that would have already been set up there, but then I would go ahead and after disposing of the stool contents into the toilet, I would have placed that bag into the trash. Now, because my kit only came with 1 colostomy bag, we're going to go ahead and presume that I've tossed this one out and have a new one off to the side here. Same thing with the base plate. The kit did only come with 1 base plate, so we're going to be reusing this one here. To take off the base plate from the patient, I'm going to go ahead and work towards from the corners and work towards the stoma so that I'm not causing any skin tear or any tissue tearing. Gonna remove the base plate, working towards the stoma with the corners, and checking in with the patient, making sure that they have no pain. How's your pain level? Are you doing okay? All right, I'm just gonna remove this base plate here as I observe your stoma. Now, bleeding may be normal, but I'm also checking the stoma for the tissue color, looking for that beefy red color, making sure that it's not bluing, which may indicate some type of circulation issues, making sure that there's no crust or any type of skin issues going on around the patient's stoma. And all right, patient, so I'm gonna toss this base plate into the trash. Again, the red biohazard bag into the patient's room, but of course, with the kit only having 1, I'm gonna set this off to the side, presuming that it is a new base plate. All right, miss, so I'm just gonna go ahead and clean up your stoma here. I'm gonna be using my washcloth with the approved solution on it. And as I clean your stoma, I'm gonna start from the center and work my way outwards. Now, we may experience some bleeding, which of course is normal as long as there's, as I'm observing it, no discoloration, which is a big thing to look for because of the circulation that may be an issue. So using one side of the cloth, working my way from the center, working out, switching sides of the cloth, center out, All right, and you're not experiencing any pain as I do that? Okay, great. So I'll go ahead and toss that cloth away, and go ahead and take my second cloth and begin to pat dry the patient's stoma. Switching sides to make sure that I'm getting a nice, even dry area around the stoma. All right, so the next thing I'm gonna do is I'm going to measure the stoma using my stoma guide, and I'm going to observe the appropriate size of the stoma. Now, with the guide, I already had it pre-cut and tried a couple different sizes here. Looking at the 32 millimeters, it is roughly the size of the stoma, and it does look like it might be a little too snug. We don't want it to be too tight as to impede circulation on the stoma. We also don't want it too loose because that would not create a proper seal around the stoma in the colostomy bag. So I've measured out, I have a 35 millimeter hole that looks to be the appropriate size for the patient's stoma. I've got that measured out. So we'll go ahead and remove that measuring tool. And then we're going to cut the base plate using the 35 millimeter template here. And a new base plate would require me to lay down the template and use my pen and my scissors to begin that process. So the new base plate, of course, will be wrapped. I will take my pen and draw the template out for the base plate there of the colostomy bag. Once I have that drawn out, I will take my scissors and I will go ahead and cut through the base plate to make sure that it is the appropriate size. Then I will go ahead and remove the adhesive. And prior to sticking it onto the patient, I'm going to take my stoma cream here, my stoma solution, and I'm going to apply it around the patient's stoma, which ensures that a proper seal is going to go ahead and take place. I'll give that a second there to settle onto the patient. I'll unstick this new base plate here that's already, I've just cut out the whole size for it, and I've went ahead and unwrapped it, and I'm going to place it over the top of the patient's stoma. Looks like a perfect fit there, so we'll go ahead and stick that on there. Go ahead and make sure it's an even stick across the patient. There's no overlapping of the base plate, and that it is evenly distributed across the patient's body part here. And so that there's an even stick. We don't want it to be folding over or inconveniently placed there. Then I'm going to go ahead and take the new colostomy bag, and I'm going to stick that onto the top there, and it has a ring that goes around here, which I will just attach to the base plate. So to do so, I'll go ahead and place that onto the ring and ensure that it clips in there. All right, and then I'm going to gather my supplies. Go ahead and of course, with the new bag, we will make sure that it's tied off so that there's no leakage that would have been done prior to sticking it onto the patient. And ensuring that the patient isn't feeling any pain, that the patient's comfortable, that they have no questions. If they have any questions, just want to advise them of their stoma care or give them any advice of how to make sure that they're applying the right size or anything that they may need to do at home. Outside of that, I'm going to gather my supplies. I'll make sure that this is in the biohazard waste bin, and I will go ahead and exit the patient's room, make sure that they have a call light next to them if there's anything that they need. My name is Nicholas. You can go ahead and push that call light. I'm just going to go to the nurse's station and chart my findings. I'll go ahead and close the door for patient privacy. And thank you.